A spine fracture is usually the result of osteoporosis, which causes a compression fracture of the vertebra. And according to Dr. David Dufter of Desert Regional Medical Center in Palm Springs, there are procedures that can repair the fracture.
Well, there are many different causes of back pain, of course. One of the causes is that a person can have a compression fracture of the vertebrae. That usually occurs because of osteoporosis. In other words, the bone becomes weak and it can't support the load that is applied, the load of the body. So the vertebrae, in effect, collapses. It's very painful because it is a broken bone. Osteoporosis can involve the entire spine. We see the most common occurrence is at the thoracolumbar junction. That is the bottom of the rib cage where it connects with the low back, the lumbar part of the back. And at that junction is the most common level for compression fractures. Well, the diagnosis is usually very straightforward. An X-ray shows a compression fracture, and then usually the next test is an MRI scan to further evaluate whether this is a new fracture or an old fracture, and whether there's any involvement of the spinal cord or the spinal nerve roots. Usually that's all the information we need. So the good news is that we have a new technique that's done through a very small incision. We do it under X-ray vision so that we can see exactly where the device is going in, and we can actually fill the broken vertebrae with bone cement. So you do not have to depend on the bone healing. Basically the bone is propped up or filled up, if you will, with bone cement. This is the device. It's a small balloon that is inserted through a small incision. The incision is about 1/4 of an inch, and through a small metal tube, this device is inserted into the vertebrae like so. And once it's inside the vertebrae, then we use this little pump device to fill the balloon with a liquid that shows up as a dark spot on the X-ray machine, so we can see exactly where it is. Once the balloon expands, it actually pushes the end plate of the vertebrae apart from each other so it can restore the vertebral body height. In other words, it undoes the compression. It can elevate or restore the vertebral body height. Once that's done, then the balloon is taken out. So the balloon does not stay in. It's taken out. The bone will stay open in this position, and then we fill that hole, that little cavity inside the bone, with the bone cement that spreads out, and it keeps the bone supported. The procedure takes about an hour. The patient wakes up in recovery room, and the pain that comes from the bone is gone immediately. That's the amazing thing about this operation. And the patient's able to get up and walk right away. As soon as they are recovered, they can get up and walk. So the recovery time is very short. The success rate from this procedure is 85 to 90%. Most people experience dramatic pain relief. I did 2 cases this morning, both of which had 2 levels, so that was 4 fractured vertebrae. And in less than 2 hours, we repaired the 4 fractured vertebrae, and the patients had very good pain relief. So it's very gratifying. It's interesting technology to handle and operate, and the rewarding thing about it is that the patients do so well.